Right, it's time for business with our partners 2 Degrees. Data on our services industry is out later today. Will it just fan the flames that we've seen from manufacturing? Garth Bray joining us, Business Desk. Garth, good morning.
Good morning, Ryan.
So the PMI and the PSI, they're both very important indicators for us. We had manufacturing on Friday.
Yeah, and that was up, and it was sort of up on on gains that it made previously. Anything over 50 in that index means that it's expanding, and it had already tipped over into the 50 plus territory last month, and it was 51.4. So a little bit of growth there.
Right.
And also particularly in the orders area, the orders were really up. In fact, 4 out of the 5 categories they measure, because they look at other things like finished stocks and employment, they were all expanding. The employment part wasn't, but I mean, we expect, you want to...
That lags.
Yeah.
Good, overall, that is good. Manufacturing, good Friday.
Good news.
And going in the right direction.
Wonderful.
Because for ages, we were below 50, which means you're in reverse.
Yeah. And this is good. So we'll wait and see. I mean, obviously, services, much bigger impact on the economy.
Yes.
Dropping out later today. You'd hope to see a bit of growth there.
Services is like 70% of our economy, eh?
Yeah.
So we want this number to be going well. That's coming out this morning, isn't it?
Yeah.
Very good. All right. More businesses use private health insurance now as sort of a lure.
Yeah. This is just something we've picked up on today. Obviously, as the costs are rising, I think the inflation for, way ahead of general inflation, 7 to 14% in the last year, the jump in sort of medical costs. And so you're seeing more employers picking up on these group health schemes, which is basically where they subsidise the cost of getting into a private healthcare or, Southern Cross or anywhere. They've all bumped up premiums, sort of 21%, I think, across the board from Southern Cross and about 17 to 40%. So it's obviously quite expensive to get private cover still in this country. And but what they are arguing for is a tax break. The Financial Services Council says, look, firms that offer this get stung with a fringe benefit tax. They want to try and broaden it all out. They're saying this is increasingly kind of a nice carrot for people from countries where the healthcare system is a little bit more like where we're heading rather than what we've had, which is more expensive with longer wait lists and more private.
So do we get free health? We don't get free health insurance for working here, eh?
How do you make
At NZME, they don't offer a free or subsidised. Because at my previous job, because it was American owned, we all got private health insurance free as part of our contracts, even though we don't really need it. But that was sort of part of the thing that they offered. So more people doing that.
Lots of different ways to skin it. I mean, I think about Australia, where they actually run it the other way around. They tax you more if you don't have private health cover and you earn more than, I think, 97 grand a year or something. So they've got a different kind of way of weighting it. But there are a lot of different ways to try and work it out so they can spread the load.
And now Bitcoin. People using Bitcoin might find themselves in a bit of a pickle over tax.
Yeah, right. Because people possibly think of cryptocurrency as a currency, but the way it's treated from tax purposes, it's like an asset. It's like buying or selling a house or a chair or whatever. And if you're buying and selling something for in the expectation of the benefit there, you'll get stung with a CGT. So what this breaks down to is if you're using Bitcoin for, say, a coffee, you pay $6 for your coffee, you've got a tax liability or possibly a loss, depending on whether that Bitcoin went up or down in value between when you bought it and when you sold it. So it's not really like money. I know, complicated. The Bitcoin industry, it's after a tax break as well. It says we need to have some sort of system, which means if you're spending less than $1,000 worth of it, so you're just buying a coffee or buying clothes or whatever with this cryptocurrency, you don't have to account for that. Otherwise, it's bewildering. They reckon something like 70% of people that use Bitcoin for purchases, admittedly not a huge number of people probably in this country, are non-compliant on their tax on this.
But why is Bitcoin different from... I mean, it's...
Because you don't... I mean, like, if you spend $6 that you earned last week...
Yeah.
You don't get charged on the change in the value of that money over time because it's currency. But because Bitcoin you're buying essentially a crypto asset, it's saying, well, the value of that asset might have changed in that time. So you're effectively, it's like you're selling something that's appreciated in value. You've got to pay a CGT on that.
Is it?
Yeah.
In New Zealand? Why just that though? I mean,
well,
why not?
And a range of other, because it's like anything that you buy or sell. It's like the bright line test on houses and so on. So you do pay for it. Yeah. So they're basically after a CGT exemption to try and make this happen.
Okay. All right, Garth, interesting stuff. Thank you. Garth Bray from Business Desk. Thanks to our partners 2 Degrees.